Mr. Dietrich, I'm Dr. Charles.
Hey.
How are you?
Good, good.
I have come to render an assist with this deceptively tricky brace.
Sure. Chief of Psychiatry?
Technically, yeah. Today more like chief of physical therapy. I blew my knee out slopes a couple years ago. Got stuck with one of these suckers for a few months. The trick is the buckles.
Okay, great. Good to know. Thank you.
So, how'd you do this?
Ugh, just one of those mornings completely overbooked. Point is, I was running late.
And on your cell phone.
Right. I was on the phone with my insurance broker. Need to up our homeowners. Anyway, so I stepped out into the crossing, tried to jump out of the way, but couldn't. So, boom, I'm on the ground.
Wow. Hell of a morning.
Yeah. Well, I'm just thankful for the intrepid Miss Reese here for patching me up so I can get on with my day.
You know, you can't really drive like this, so what, should we call your wife?
No. I just mean she's really busy. Billed nearly 80 hours last week, so I don't want to bother her with something like this.
Great. Nice to meet you.
Yeah, pleasure. Thank you.
Miss Reese, could I just see you for a second?
Dr. Charles, good news. I'm out of here.
Before you go, could I just talk to you for a sec? Miss Reese, do you mind excusing us for just a moment?
Mm-hmm.
Thanks.
Yeah, I really have to go.
I will not keep you for more than a minute. I just want to understand a little better what happened this morning.
I already explained. It was an accident, and I'm sorry, but I'm really late.
I understand you're a very busy man. Listen, off-the-wall question. Have you been having a hard time getting out of bed in the morning recently?
No. I have to go. Thanks.
Mr. Dietrich?
Excuse me.
Mr. Dietrich, I'm sorry. I can't let you leave just yet.
What are you talking about?
I am not convinced that it was an accident when you stepped in front of that car this morning. I think you were trying to kill yourself.
What?
Dr. Charles?
And I'm worried that you still might be a suicide risk. And if you insist on leaving,
I do.
I'm going to have to place you under a temporary psychiatric hold.
This is ridiculous.
Well, Earl here is going to take you someplace quiet, and hopefully we can talk.
I will sue you and this entire hospital.
Thank you, Earl.
I'll have your medical license. You can't do this.
I can't actually.
What?
I've got a charge nurse in city lockup and an ongoing child abuse investigation, and you bring me this?
He tried to commit suicide, Sharon. I wasn't about to let it happen again.
He's a successful lawyer with no past history of depression.
I know the type, okay? Look, the way he recounted what happened, this need to sell this way too detailed version of the narrative, right? Look at this x-ray. He took the impact directly above the knee. Directly. That means he stood in and took the brunt. He wanted to get hit.
That's conjecture, Daniel. You're usually not this quick to make a diagnosis.
With this condition, you become a master of disguise. Just give me a little more time to see if I get him to drop the mask, okay?
All right, just
Okay.
find a way to do it without further complicating my life.
Mr. Dietrich, how you doing? You know what? I am going to tell you why I think you threw yourself in front of that car. It's precisely because you think you have the perfect life and you're still miserable.
So what, I'm an ingrate?
It's called endogenous depression, and it's caused by your brain chemistry. And like so many people who suffer from depression, you're ashamed to tell anybody about it because you think it's your fault.
Okay. Yeah, I bet. Sure.
Okay. Look, why don't you call your wife? Tell her where you are, why you're here. She's an attorney. She'll get you out of here in 5 minutes. She knows what to do. Well, you don't want. What? You don't want to call her? Why, you worried that maybe she finds out that you're not the brave, strong man she married, she might not love you anymore? Do you know that the single greatest challenge that I face is trying to convince people that depression isn't a sign of weakness?
Okay, I'll remember that if I'm ever depressed.
Okay. You know, I gotta hand it to you. You're one hell of a performer. I mean, a real trooper. I mean, you're keeping it up for so long. You're selling this idea of who you think you need to be all the time. Carrying around the weight of that performance. Isn't it tiring? Aren't you exhausted? I think it'd be exhausting.
I have absolutely no excuse to be sad.
You don't need an excuse, man. You're a human being. You're not alone, Mr. Dietrich. Miss Reese, I was unkind to you. And I hope that you'll allow me to apologize.
It's okay. You were sleeping. I woke you.
That is a good way to put it.
You don't like Chicago-style popcorn?
Mixing caramel with cheese flavors?
Sweet and salty. It's the greatest duo.
I thought the great duo was Jordan and Pippen.
Oh. I've been off my meds.
Since when?
I started titrating myself down about 10 days ago. I'm sorry, it was a little chemistry experiment. I really should have told you during our last session.
How's the experiment going?
Not great. The black cloud is descending. There ain't no denying it.
Why did you go off?
About a month ago, I started to feel fuzzy. You know, like I was losing my edge, like my antenna. I mean, you know the focus that it takes to treat patients? You know, I was worried that I was going to make a mistake.
Daniel, you also can't treat patients if you're depressed.
I think I would have figured that out by now.
Let me adjust your dose. We'll figure out a balance.
Okay.
Get him off of me! Get him off of me! Get him off of me!
Robin Charles, early 30s, delusional and combative. Lacerations on the soles of her feet. Treatment 6.
She's on 4 milligrams of risperidone, nothing given in the field.
Vitals?
No, too agitated, couldn't get her hooked up.
Get him off of me!
We set? On my count, 1, 2, 3, so.
Robin, do you know where you are? Do you know who I am?
Hold me!
We need to sedate her. 5 of olanzapine, 50 of Benadryl.
2 of Ativan, 2 of Ativan!
Get him off of me! No! 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 No!
Dr. Rhodes?
So you starting to figure out why I didn't want to leave you in the
She was
hospital?
rational. She was lucid.
I warned you.
Robin was fine, okay? Suddenly she
Suddenly, look at her now!
This is on you. You did this.
Mr. Kellogg, I'm the charge nurse.
Is Dr. Charles ready to see me? I texted him I was coming.
He may not be checking his messages. He had a family emergency.
He told me that I could see him anytime. He promised.
I'm sorry, but I can have one of his residents see you.
I'm not talking to some underling. Is Dr. Charles here?
Yes, but I don't think he's going to be available.
Tell him that I'm not going to be treated this way. I'm going to stay right here and wait until he comes out.
Okay.
Hey, give me a cup of coffee.
The vending machine's right there.
Dr. Charles, I have been reviewing Robin's history just to make sure we haven't missed anything. And, well, some of her symptoms, they're not consistent with a psychiatric disorder.
Dr. Reese.
Let her finish.
2 days ago, when Robin came to the hospital, she was running a mild fever, 100.2, and her BP was elevated. Now, at the time, we didn't think anything of it.
That's because it's a very mild fever. And of course, her BP was elevated. She's on a forced hold. She's agitated.
But when Robin was brought in today, it seemed she was experiencing visual hallucinations. Now, auditory hallucinations indicate a mental disorder, but visual hallucinations should be considered organic until proven otherwise.
I think we all wish that Robin had a treatable physical condition rather than...
I want to check her ceruloplasmin levels and run an FTA-ABS as well as an MRI and EEG to rule out sclerosis and epilepsy.
Of course. Do it. What's the matter with you?
She's trying to make me feel better. And bless her, but she's grasping at straws. Come on.
Are you so blinded by your fear that Robin inherited her problems from you that you won't even entertain an alternative?
False hope, Sharon. Come on. I don't need any.
You don't know that. Where's the Daniel who leaves no stone unturned when diagnosing a patient? Where's the Daniel who never gives up? Don't you think your own daughter deserves that much?
You were right. The tests I ran, there's no indication of any organic medical condition. I'm sorry.
Robin's showing dyskinesia. Did you notice that before? You know, the jerky movements?
Yeah, I assume it's from the antipsychotics.
Yeah, it could be. Did you order a paraneoplastic panel?
For autoantibodies? Why?
Could we just run one?
Of course.
Reaction to your antibodies caused your psychiatric symptoms.
So I was crazy, but I wasn't crazy.
Yeah, something like that. You should know something. It was your dad that came up with the diagnosis. He's hardly left your side. You should talk to him.
Hey, sweetie. Honey, Robin, I
Dr. Charles.
Mr. Kellogg?
I've been here all day. You haven't answered any of my messages.
I'm very sorry. I've had an unusual day. Is there any way we could talk first thing in the morning?
secure the gun?
Yes, ma'am.
Check him. Daniel? Daniel, I'm here. Oh, God. It's okay. It's okay. Do you know who I am?
Sharon.
Yes, yes. Do you know where you are?
Oh, Med.
Yes, that's right. That's right.
He's alive, but heavy scalp bleeding.
What the hell happened?
He got shot in the abdomen and he's lost a lot of blood.
Baghdad.
No, we're going straight to the OR. Tell him we're on our way up.
Hang on, Daniel. Stay with me.
We're gonna take good care of you, Dr. Charles.
Dr. Charles, can you identify the man who shot you the night of May 11th?
Yes, he's sitting right there, Jack Kellogg.
We're all very grateful you pulled through, Dr. Charles. There's certainly no one here would blame you for wanting to see Mr. Kellogg pay for the physical and emotional distress he's caused you. Now, just a few weeks before Mr. Kellogg shot you, he'd been a patient of yours, right?
Yes.
And at that time, his actions and his behavior warranted enough concern to place him on a 72-hour psychiatric hold for further observation.
That's right.
So you were aware that Mr. Kellogg was a severely troubled man?
Yes, yes, I was.
The jury's already heard testimony from some other experts who claim that Mr. Kellogg's mental state does not meet the threshold of what would be considered legally insane. But they weren't able to evaluate him until well after the incident, correct?
That's correct.
And they weren't there in the moment when Mr. Kellogg shot you and then himself.
No, they were not.
Then would you say they're qualified to evaluate Mr. Kellogg?
No. In fact, I wouldn't. With all due respect to my colleagues, I feel that I am uniquely qualified to answer the question at hand, which is, what was Jack Kellogg's mental state at the time that he fired those bullets? And I believe that he was legally insane at that time.
So in your expert medical opinion?
I think that Jack Kellogg should be declared not guilty by reason of insanity.
Thank you, Dr. Charles.
Oh, there you are, Dr. Reese. You'll be happy to know that Mr. Kellogg was found guilty.
I'm not happy, but I am satisfied with that verdict. He'll still receive treatment in jail.
Through the Department of Corrections? You have any idea what their success rate is in that environment? His chances of rehabilitation are practically nil. Not that it really matters, because more than likely, his temper will get him killed within a week.
Those outbursts are an act calculated to convince you he's crazy.
Is that what he was doing? Dr. Reese, I've been evaluating psychiatric patients for more than 30 years. Is it conceivable to you that I might have more insight into his behavior than you do?
Daniel, give us a moment, Dr. Reese. Daniel, you recruited her because you liked that she thought for herself. Don't hold that against her now.
Sharon, Kellogg is not a criminal. He's a confused guy in a lot of pain who needs some help.
Like someone else I know.
What's that supposed to mean?
Look, I didn't say anything when you insisted upon returning to work before you were cleared to, because I got it. It was important to reclaim your agency, but now, here you are, the one person in Chicago willing to champion the cause of the man who tried to kill you. I gotta say, it concerns me.
Why? Because I want to send him to an asylum? Not a day spa instead of a prison? Because I want to treat his illness instead of punishing him for him? It's still my patient.
Very noble, Daniel, but I don't think that's what this is about. I think this is about your guilt and your ego. You had a killer on your hands and you missed the signs. And now you're trying to make up for your mistake. You're trying to fix it and get back in control. You've been through so much, Daniel. Let it go. Stop torturing yourself.
Sorry I wasn't here to help ease you into civilian life. I mean, for all the good it did, I probably should have skipped testifying altogether.
It's okay, Dad. I wish I could have been there for you.
Oh, phew. I mean, at least I knew you were in Connor's very capable hands.
What is it?
He doesn't trust me.
What do you mean?
I saw a look on his face. He thinks my feelings for him are part of my disease.
Oh, honey.
Is he right? Or is this just all in my head? And that's part of the disease. Dad, how do I know it's real?
We're all driven by so many different things. Truthfully, a lot of the time I don't have a clue why I do the things that I do. But I mean, even if you can't always trust your brain, in my experience, you're usually pretty safe trusting your heart. You know?
What was her normal dose of quetiapine?
It was 800 milligrams, but I cut it in half to be safe for the baby.
Huh. That might explain the onset of the mania.
Well, the standard of care is to cut the dose in half.
And there's actually been some new research, a couple new papers, both suggesting that
Dr.
more
Charles,
gradually.
I can't keep up with every psychiatric journal.
Of course you can't.
Or I didn't have a choice. I did what I had to do.
Dr. Manning. What's wrong?
Your placenta must have abrupted from the accident. Call OB, we need to get her upstairs for delivery.
Delivery? Did something happen to my baby? Is he gonna be okay? What's wrong with my baby?
Everything's gonna be fine. Let's get you upstairs, and then we'll figure out what happens next, okay?
Are you sure I didn't hurt the baby? Are you sure? What if I hurt it? What happened? Why did we stop? What's going on?
I don't know.
Okay?
Why are we here? What is this place?
Orthopedics. They're renovating the rehab floor.
I'm supposed to have my baby. You said I was bleeding.
Emergency exits are locked.
I was thinking maybe a code orange would explain why the elevators went down.
Oh, there's a lot more blood. A lot more blood.
Her bleeding is much worse. Call labor and delivery.
Worse? What does that mean? Is my baby dying?
No. We need to lay you down, okay? Come on.
He's dying, isn't he? My baby's dying.
No, he's not. Come on, let's lay you down. Just lay down right here. You're all right. There you go. Dr. Charles?
There's no signal. I can't find a signal.
Oh my God, I killed him.
Just stay right there, okay? We have to figure out a way to break open these doors. We need to get her upstairs.
Natalie, we're not getting through those doors. We're gonna have to do a C-section.
It's all my fault. I killed my baby.
I've never done a C-section. I haven't even seen one in years.
We're gonna figure it out.
But we don't have any instruments or emergency supplies or pain meds.
There's gotta still be some supplies on this floor.
What if we just held pressure? I mean, whatever's happening in the hospital right now can't last forever.
We have to do this now. We don't have a choice. Listen, whatever doubts you may or may not have about your previous treatment of this patient,
I led her to believe that she could go through with this pregnancy. She can't take care of a baby. She can't even take care of herself.
and you were in a very difficult situation.
If I operate on her in this hallway and she dies, that's my fault.
Okay. Okay, look, I'm going to find a signal and get an OBGYN on the phone.
But no one can get down here.
No. So she can talk us through it on the phone. Together. Okay? Yes, this is Dr. Charles. I need an OB immediately to talk me through an emergency C-section. They're getting Dr. Grant.
Come here and put her on speaker.
I can't. I'll lose the call. I'll drop the call. Dr. Grant, thank God. I have a woman, 36 weeks, abrupted placenta, already lost a couple units of blood. Some lidocaine, which we've administered, a scalpel, and a few clamps. Okay? Okay, here we go. Dr. Grant says to start the incision 3 centimeters below the umbilicus.
Okay. Here we go.
Okay, tell Dr. Grant I'm through the uterine wall and ready to deliver.
Through the wall. There's a baby in the wall.
Yeah, she's through the uterine wall.
Hold on. The placenta's in the way. I can't see the head. Ask Dr. Grant if I should extend the incision or reach through the placenta.
Can you reach around it? Is there any room?
Ask Dr. Grant.
Yes, Dr. Grant. Dr. Manning wants to know if she should extend the incision or go through the placenta. Dr. Grant says that she totally trusts you to make that call.
No, she needs to tell me which way to go.
Make the call, Manning. Manning makes the call.
Dr. Grant says that without being there to assess the position of the placenta, there's no way that she can make that determination. You need to decide.
I'm going through the placenta. Hold on. It's too high. I need you to come over here and push down on it.
Here?
Yeah, I think so.
Okay. I'm sorry, but you're gonna feel this.
God, get out of here! Help!
You got the baby?
No. Maybe I should do the incision.
Stop! Get off me! Stop!
Okay, hold on. How about now?
Yeah, okay. I think... Yeah, there it is. Okay, push again. Push again. I got it. Push. Got it. Got him. Keep pushing. I got it. He's not breathing. His trachea is blocked with secretions.
What do you need?
An aspirator, something to get the secretions
All
out.
I got is IV tubing.
Give it to me. It's okay.
You did it.
Yeah. Dr. Charles, you lied to me.
Yes, I did.
You tricked me into doing a surgery that endangered both Claire and her baby. What you did was reckless and unprofessional. You had no right to manipulate me.
Can I show you something?
She looks good.
Yeah. Meds kicked in. Listen, you were trying to solve a very tricky problem, and most doctors would have tried to talk her out of this pregnancy. But you saw the woman, not the mental illness. You have excellent instincts, Nat. Just gotta trust them.